Just to give you some real quick stuff, the harshest immigration laws in the country are in the state. We know that, right? That's going to impact Latinos and whether or not they're willing to come in and get services. Actually, what we're finding in Phoenix is that many of our folks are willing to come in and get services. They're so smart. If you don't sign up for access, the provider doesn't care about your documentation. You just pay cash. So people come in with their cash and pay for their services. There's been a 64% increase in the number of Arizona deportations, and Arizona has 1/5 of the total deportations nationwide. In 2007, they showed that 14.3% of Arizona's population lived in poverty. That's actually gone up with the new census. That's actually gone up quite a bit. I think it's more like 19% now. We're 49th in the state, or how do they put this? We're number 2 in the country for having the highest poverty rates in the country. And the only state that outdoes us is who? Mississippi. You've got people here who live below the poverty line, 5.1%. That's actually higher now too with the census. Compared to, but look at this, 19.7% of Latinos lived below the poverty line. That was back in 2007. The number is higher. You have to think in terms of the poverty of your clients. You have to think in terms of their struggle with just trying to survive. Okay, and some of the other determinants I looked at, hate crimes on the rise with Latinos, especially right now. On the rise, and they're not reported. If you have no sense of physical safety, you will not protect yourself sexually. They simply don't matter. It doesn't matter. These folks are not feeling safe. Domestic violence is huge in the Latino community. It is in many communities. Just because women, we think we moved way ahead, but I can tell you a lot of men still look at us and think that they own us. Even within the gay community, much DV. Much DV. We live in America where violence is acceptable behavior. Now, we can lie about that all we want to. We can say, oh yeah, we got all these laws and policies, blah, 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 blah. We do not honor human life in America. It is a lie. And so, that is a determinant we need to deal with as public health people. How do you incorporate this? How do we take the social determinants? And once again, you have to define that for yourselves. It's not for me to come in and tell you which social determinants most affect Latinos in this community. You need to determine that. Have some very strategic conversations among yourselves around what that looks like and what we need to do. Daily living conditions is number 1. If it's bad, you gotta do something about it. That may be you, that may be your policy, your legislator. That may be the police department. That may be neighborhood cleanup. But you got to figure out what that is and how to address it. Tackle the inequitable distribution of power, money, and resources. And then measure and understand the problem and assess the impact of the action around that. And so it takes work. If you want to make a difference and make sure that the numbers of folks living with HIV in the Latino community get even lower, and that people who live with the virus get the care they need and live quality lives, you really have to look at all of this. Because HIV, of all the diseases, is probably the disease that impacts the most vulnerable people in the world the most. When you look at it, it is with communities of color, it is with the poorest people, it's where civil strife goes on, any kind of military action that's going on, look at the Sudan, wherever that kind of, that's where you're going to find HIV. Okay? All of this has to be taken into consideration. You can't have a discussion around someone's behavior and not look at the determinants that affect that behavior. It's unfair to them because you can't walk into that person's space without bringing judgment to them. When you're addressing them, collaboration is huge. Community building and mobilization, building of community capacity, research, science, and culture, fund development, cultural appropriateness is huge. Leadership development. Leadership development is huge within the community. And that's grassroots development. They don't have to have a master's degree, even though that's fabulous. It can be the leaders that work in the fields themselves. They can be anybody. Everybody has leadership ability. It's a matter of us finding out what they need and how to develop that. And then evaluation. Don't be afraid to evaluate what it is you do. And then I just wanted to link some local and national resources that you probably already know about. The National Council of La Raza, Chicanos por la Causa, Urban League, Concilio de Salud. Concilio is actually in Phoenix, and the Urban League is everywhere. Link into your urban leagues if you have not. And I know you have a Y here, link into your Ys. The Hispanic Chamber of Commerce. Medical professionals are always missing in the room. And I hate to say it, but they are. Ryan White Council. The Community Planning Group of Arizona, which is what we call the PPGA of Arizona. They're the prevention side, and they figure out, it's a community government partnership that figures out how money is going to be spent in prevention for Arizona. The Arizona Public Health Association, of which I'm a board member. We have a sexual health section for that board now. The American Civil Liberties Unions, NAACP, Equality Arizona, NACWA, which is
National Association of
People with AIDS, yes. NASDAD, and then the Office of Minority Health Resource Center. There's so many. Look at it nationally as you're looking at your partners. Look at it locally.
And I like to look at life wellness in a holistic kind of approach, because wellness isn't just one thing. It's made up of physical, emotional, social, intellectual, spiritual, environmental, occupational, plus some other factors too. Starting to sound like social determinants. One of the things we've talked about is financial wellness. And financial wellness is being comfortable where your money comes from and where it's going. Occupational wellness. We don't think about wellness being a part of our jobs and our occupational life. But we have heard things like, doing what you love. A person is really blessed if their work can give them joy and if they can do what they really love. So occupational wellness is another area. Resilience. We talk about pandemics and we talk about preparedness. There's a site called Do One Thing for someone you care about as a way to be resilient and to take care of yourself. You heard the Red Cross thing for preparedness. Make a plan, get a kit, be involved. You know, it works real well for HIV outreach and education and stuff too. Make a plan. What are you going to do tonight? Are you going to go to the bar? And do you think you're going to end up going home with someone? Okay. How much are you going to drink? Is that going to affect your judgment? Get a kit. A condom's a kit. It's a little kit. And get involved. Volunteer. Get out in the community and do something. So this site talks about preparedness and doing one thing every month to get prepared, to get yourself and your loved ones prepared for a disaster. Emotional wellness is real important. HIV positive Spanish speakers don't have a lot of resources. This Latinos Positivos Ontario was an advocacy organization specifically for and run by HIV positive Spanish speakers. The Center for Spanish Speaking Peoples, also Toronto PWA Foundation, and the AIDS Community Care in Montreal all have resources for Spanish speaking. Environmental wellness. Signs of good environmental wellness, you're aware of the limits of the Earth's natural resources. That includes people. Human resources are one of our greatest natural resources, and children are the biggest one of those. You conserve energy, recycle, spend time outside in natural settings, you don't pollute the air, and you avoid secondhand smoke by not being the person that puts out the secondhand smoke. Another area of wellness is stress wellness and relaxation wellness techniques. Some of these are progressive relaxation, deep breathing, assertive skills, thought stopping, and visualization.